Bismillahirrahmanirrahim. Quote of the day, and do good indeed, Allah loves the doers of good. This is the quote from Quran. I am Dr. Aamna Khalid, and I will be presenting on the topic of World Bank and USAID under the kind supervision of Professor Dr. Saira Afzal. Learning objectives for today's presentation are overview of World Bank and USAID, different institutions of World Bank, their key projects, their recent programs, their projects running in Pakistan, current status of USAID, and then the MCQs. World Bank has been working since 1944 and it aims to become a better bank for a better world. Their mission is to end extreme poverty and boost shared prosperity on a livable planet. This is a brief history of World Bank that has been working since 1944. It started from a conference. Then the World Bank began to struggle to become a builder and engineer. Then it confronted the poverty from 1968 to 1981. Then it started working for the economies in transition and structural adjustment. And since 1995 till now, World Bank is working for the sustainable development and global partnerships. There are five different institutions making one World Bank. Number one is the IBRD, International Bank for Reconstruction and Development. Then IDA, International Development Association. Number three, IFC, International Finance Corporation. MIGA, Multilateral Investment Guarantee Agency. And then the SID, International Center for Settlement of Investment Disputes. We will discuss them one by one. First is IBRD, the International Bank for Reconstruction and Development. It's a global development cooperative owned by 189 member countries. It provides financial products and policy advice to help countries reduce poverty and extend the benefits of sustainable growth to all of their people. These are some recent projects of IBRD. The one running in India, the transform market for rooftop solar. The one for better crops with better irrigation. The third one working in China for improving rural migrants' employment prospects through skills development. Then the second institution is IDA, the International Development Association. It's a part of World Bank. It focuses on assisting low-income countries. It was established in 1960. Now it comprises 175 member countries. It is one of the largest sources of assistance for the 78 low-income countries. IDA provides grants and low-interest loans that help countries invest in their futures, improve lives, create safer, more prosperous communities worldwide. These are some special themes of IDA. First is climate change. Number two, fragility, conflict, and violence, breaking the cycle of conflict and poverty. Number three is gender and development, fostering gender equality and empowerment. Number four is the human capital, investing in people for greater equity and economic growth. And number five is jobs and economic transformation, creating good jobs and supporting a strong private sector. These are some of the projects of IDA in different countries. The one is shown from 2021. That's from Afghanistan, supporting institutional improvement and rehabilitation of municipal infrastructure in Afghanistan. Then the second and third are from Pakistan, and the one from 2020 and the one was from 2019. World Bank committed $300 million to support human capital and livelihoods in Pakistan. And the second project in Pakistan was in our province KPK for the Khyber Pakhtunkhwa Revenue Mobilization and Public Resource Management Project. The third institution of World Bank is IFC, the International Finance Corporation. It improves the lives of people in developing countries by investing in private sector growth. It can connect economic development with humanitarian needs to create real progress for the people and places that need it most. This is the huge impact of IFC that 15 million people were provided with water, sanitation, and hygiene. 164 million people were provided with access to electricity. 69 million people were provided for 69 million tons of greenhouse gas emissions reduced per year. 52 million people with strengthened food and nutrition security. 152 million people and business using financial services. 174 million people using digital enabled services. So the first one was more related to the health department. These are the contributions of IFC to several sustainable development goals through direct investment. Some of them are through direct investment, and these are the part of them from 1, 2, 3, 4, 6, 7, 9, and then 10th. These are the SDGs which IFC contributes through the direct investment. And these are the SDGs that IFC contribute to them via partnership with private investors. This figure shows the IFC clients working for the SDGs, and you can see on the left side that most of the clients are more inclined to the SDG number 5, 8, and 10. And on the right side, you can see the yearly report of the number of IFC clients that are inclined to different SDGs. This is the figure showing the number of IFC clients from Pakistan from the almost 5 to 6 years. And you can see that there is a huge fluctuation in the number of clients. Some of the clients are increasing, some of them are decreasing for different SDGs. The SDG number 2, that's zero hunger, that's more related to health. You can see that the number of clients have been decreased from the past 2 to 3 years since 2018. Then the fourth institute is MIGA, the Multilateral Investment Guarantee Agency. Its mandate is to promote cross-border investment in developing countries. Three major strategies of MIGA is to help countries respond to COVID-19 pandemic and its economic impact. Number two, role in meeting capital package commitments. Number three is the support of climate finance. Fifth institute is International Center for Settlement of Investment Disputes. The figure shown below is just to show that some of the settlements or disputes from Pakistan are over there. The second is pending, and when we open it, although here it's in a different language, but when we open it, it shows that it's the pending project is something related to the highway construction dispute. So moving on to the major priorities of World Bank Group. Related to the people, it promotes global health, inclusive education, and social protection. Related to prosperity, it invests in projects, policies, governance, and systems that create opportunity and prosperity. From the point of view of infrastructure, it develops safe and sustainable energy, transportation, and urban mobility. In the Department of Digital Department accelerates digital access to create economic opportunity and to transform lives. In perspective of planet, it provides sustainable food systems, water, and economies for healthy people and a healthy planet. Cross-cutting areas, it issues affecting all areas of development, including gender, fragility, conflict, violence. Key areas of health that are covered by a World Bank Group are health impacts of climate change, nutrition, pandemic preparedness and COVID-19, universal health coverage. And we will cover them one by one. First is universal health coverage. That's WHC. It's about ensuring that everyone, especially the most vulnerable, has access to the quality health care they need without suffering financial hardship. It is key to achieving the World Bank's mission to end extreme poverty and boost prosperity on a livable planet. And it is the driving force behind all of the World Bank Group's health and nutrition investments. So, what are the strategies of a World Bank to achieve a universal health coverage? Number one, to strengthen service delivery and health financing. Number two, expand services in response to demographic and epidemiological changes, including essential services promoting maternal and child health, nutrition, prevention, gender equity, as well as non communicable diseases, mental health, and long term care associated with aging. Number third strategy is to engage ministers of finance and health and other sectors for decision making to guide policy reform and achieving more efficient and effective spending for health. There are different collaborations of World Bank to achieve universal health coverage. It is collaborating with Global Financing Facility for Women, Children, and Adolescents and the Pandemic Fund. The second one is climate change, a global health emergency. Changing climate could lead to excess health costs in low and middle income countries of at least 21 trillion dollars by 2050. It is equivalent to approximately 1.3% of their projected GDP. And climate change may push an additional 132 million people into extreme poverty by 2030, with 44 million of these driven by health impacts. So, climate change is an important thing to be covered. Three key pillars of the climate change and health programs that are designed by World Bank are number one, create evidence and knowledge. Number two, invest in solutions that are country tailored and evidence based. And it utilized the bank's $30 billion health portfolio active in over 100 countries. And number three is work in partnership to maximize impact and support global, regional, and country efforts together with WHO, Global Fund, and other partners to scale up climate health action. So, how the World Bank tackles the climate driven health crisis? It strengthens health systems to predict, detect, prepare, and respond to climate risk and disaster. Number two, transition health systems to low carbon, high quality service delivery, such as through clean, renewable energy for infrastructure and fleets, and low carbon medicines and equipment. Number three, address the root cause of climate change and its impacts on health by working across sectors to scale up efforts. The number third category was health emergency preparedness. Health emergencies are not just caused by pathogens, they are also brought by natural disasters, climate related events, and conflicts. Between 2000 and 2019, there were more than 7,000 major disaster events, claiming more than 1.2 million lives and affecting over 4 billion people. So, the three focus areas of World Bank to deal with the health emergencies are number one, strengthening and scaling core HEPPR capacities. We will go to this on the next slide. Number two is enabling equitable access to medical countermeasures, including diagnostics, vaccines, pharmaceuticals, devices, and personal protective equipment. Number third is enabling rapid scale and coordinated surge financing from domestic and international sources while building emergency ready public financial management systems. So these are the projects of World Bank. Number one is Global Challenge Program on Health Emergencies. Number two is antimicrobial resistance. Key intervention across four priority sectors. The WH is the World Bank is working on. The number one is health. Number two is agriculture and food. Third is water and environment, and fourth is multisectoral. All of which are critical to prevent the emergency and spread of antimicrobial resistance. And the number third is the Health Emergency Preparedness and Response (HEPR) umbrella program to support eligible countries and territories to improve their capacities for the preparedness. Then number four is the role of World Bank in nutrition. Countries are starting to experience the double burden of overweight and stunting, and the economic cost for undernutrition are significant with at least 1 trillion a year, and there is additional $2 trillion per year is lost due to the overweight and obesity. So the projects of World Bank for this are Investment Framework for Nutrition 2024, which serves as a compendium of cost-effective, evidence-based interventions. And number two is scaling up nutrition interventions to address undernutrition globally will require an additional $128 billion over the next 10 years. The World Bank's new Global Challenge program on food and nutrition security is designed with an eye toward private capital mobilization and innovative finances resources. For addressing undernutrition in low and or middle income countries will require $43 billion in South Asia, and financing needs for obesity prevention are significantly low at about $3.5 per capita annually. This shows the projects of World Bank. On the left side is the obesity, health and economic consequences of an impending global challenge. And it's a complete report on this topic. And on the right side is a complete report on the topic of social protection, food security, and nutrition. These are the different projects of Pakistan funded by World Bank. Some of them are from Punjab, some of them are from KPK and Balochistan, different provinces. Moving on to the next topic, that is USAID. USAID, that's US Agency for International Development. Its headquarters are in Washington, D.C. It was established in 1961, and it was designed to promote economic development, global stability, and humanitarian assistance in countries recovering from war, natural disasters, and economic distress. USAID partners with private volunteer organizations, universities, private sectors, international agencies, and other governments and other US government agencies. These are the major programs run by USAID. The major focus is on these. The number one is President's Emergency Plan for AIDS Relief. It was launched in 2003. This initiative has provided more than $100 billion to combat AIDS or HIV worldwide, saving millions of lives. Number two is Global Food Security Program. Number three is Disaster Response and Reconstruction, Democracy Promotion, Economic Growth, Poverty Alleviation, Disease Control, and Conflict Resolution. These are some of the projects funded by USAID in Pakistan. Number one is increasing Pakistan's energy generation, improving transportation system, strengthening communities across Pakistan, particularly the tribal region, advancing business linkages, promoting investment, increasing incomes for farmers, improving education and access and quality, expanding access to family planning, and reducing maternal and child mortality, providing humanitarian assistance and recovery, empowering women. This figure shows the funding in Pakistan by USAID since 1951. Due to the political reasons, it dropped from 1992 to 2002, and the peak is also shown in the 2010. So, what is the current status of USAID worldwide? On January 24, 2025, President Donald Trump ordered a near total freeze on all of the foreign aid by US. Then, by February 6, 2025, reports emerged indicating that the total number of employees to be retained was just 294 out of a total of more than 10,000. And this freeze in HIV relief program, including the PEPFAR, is estimated to jeopardize treatment access for 20 million people, including 5 lakh children. This drastic action led to a sudden pause in over 30 clinical trials for ailments such as HIV, malaria, cholera, cervical cancer, tuberculosis, and leaving participants with medical devices in their bodies and cut off from researchers, likely going against the principles of the Declaration of Helsinki. And there is an ongoing debate that what will be the status of USAID in future, and it's all due to the political reasons. So this was all about World Bank and USAID. Now it's the time for MCQs. The first question is, what is the primary focus of the International Development Association? Option A, reducing poverty in the world's poorest countries. Option B, stabilizing global financial markets. Option C, supporting sustainable environmental practices. Option D, promoting international trade and investment. Option A is the right one. Question number 2. What is the universal health coverage aimed at achieving? Option A, standardizing global healthcare practices. Option B, achieving healthcare access for only the most vulnerable populations. Option C, promoting health insurance schemes. Option D, access to needed health services without financial hardship.
Option D.
Yes, option D is the correct answer. Question number 3. What strategies does the World Bank use to achieve universal health coverage? Option A, financial assistance, technical support, and policy advice to countries. Option B, implementing a one size fits all approach regardless of the local context. Option C, focusing solely on disease specific programs to help treat diseases. Option D, directly providing healthcare services using their own health centers. Option A is the
Option
correct
A.
answer. Yes, option A. Question number 4. What is the significance of the Global Challenge Program on food and nutrition security? Option A, it helps provide nutritional education to impoverished populations. Option B, it focuses on economic incentives for increased food production. Option C, it leads international collaboration to improve food security. And option D, it develops new methods for food preservation. Option C is the correct one. It leads to international collaborations. Question number 5. What role does the Multilateral Investment Guarantee Agency (MIGA) play in developing countries? Option A, it standardizes trade regulations among the developing nations. Option B, it encourages investment by providing insurance against political risk. Option C, it directly lends funds for infrastructure projects within these countries. And option D, it offers technical support and training programs to boost local industries.
Option D.
No, option B is the correct one. You can see on the previous slides as well later on. Question number 6. What is the purpose of the International Center for Settlement of Investment Disputes, ICSID? Option A, to promote international trade agreements. Option B, to enforce environmental regulations. Option C, to provide facilities for conciliation and arbitration of international investment disputes. Option D, to facilitate negotiations between countries.
Option C.
Yes, option C is the correct one. Question number 7. How does the World Bank address undernutrition globally? Option A, by providing grants and loans for nutrition-related projects. Option B, through educational campaigns and awareness programs. Option C, through research and publication of reports on global undernutrition. Option D, by directly distributing food aid to affected populations.
Option A.
Yes, option A is the right answer. Question number 8. What are the three focus areas of the World Bank to deal with health emergencies? Option A, disease prevention, vaccine distribution, and medical staff training. Option B, investment in infrastructure, research and development, and international collaboration. Option C, early detection, treatment, and research funding. Option D, prevention, preparedness, and primary health care, surveillance and detection, and response and recovery.
Option B.
Option D, it's for the health emergencies. Question number 9. Which of the following is not included in the World Bank group? Option A, MIGA. Option B, IMF. Option C, IFC. Option D, ICSID. And option E, IBRD.
Option B.
Yes, option B is the right answer. Question number 10. Which major health project is at risk after freezing US aid? Option A, TB control program. Option B, HIV control program. Option C, COVID control program. Option D, nutrition program. Or option E, dengue control program.
Option A.
Option B, HIV control program. So this is the MCQ's key. This is the link of YouTube channel on which this presentation will be uploaded. Thank you.